Good luck keeping that health plan your boss gives you right now. Good luck keeping it.
We're talking about 5% of the population.
Less than 5% of the folks in the individual market?
It's a portion of the 5%, just for precision's sake.
And so we're just talking about 5%, significant,
sure,
but nonetheless largely will do much better.
Just 5%. Okay, that would work out to, what, 15 million Americans, but just 5%. Now, my next guest is right. Try 114 million Americans, which would work out to about a third of all Americans. Betsy McCaughley is author of Beating Obamacare. I don't think I've run across anyone who not only has read this law more thoroughly, but understands it completely, eerily. So, Betsy, how do you come at that figure, 1 out of 3?
Well, because if you have any kind of health coverage, it's going to change. In fact, it already has changed. Just weeks after this law was signed, the regulators from the Department of Labor, the Department of Health and Human Services, and the IRS got together and wrote a series of regulations that made it virtually impossible for people who had their own plans or were in small group plans or even in plans provided by big employers and even self-insured employers to keep the plans they had.
Why would those who work for big employers, let's say?
Well, because certain rules. All of these employers had to provide insurance for your child until your child reaches 26. All of them had to eliminate caps on annual and lifetime payouts if you get sick.
But they've already done that, haven't they?
Yes. But when those requirements were put in 2010, it made it impossible to, quote, grandfather those plans because the insurers or the self-insurers had to collect the money from somewhere. Those are expensive benefits.
So what happens now?
So now you're going to see the other shoe drop. You've heard about the millions of people in the individual market who have gotten letters that their plans are canceled. In the next year, many, many millions of people in the small group market and even who work for large employers are either going to lose their coverage or see it very much change.
All right, so where do they go? Now, I've always argued whether they go to private exchanges or public exchanges, if they're used to what they have through their company, they're not going to have it. So that's a big adjustment.
It's very different, but the exchanges, the Obamacare exchanges, are very different from what people who have had private health insurance expect.
But even going to a private exchange is different dramatically from what a lot of these folks are getting used
yes.
to, and they don't see that coming.
But let's look at these public exchanges, because the president has said they'll be better, that what you have now is substandard or cut rate, and this will be better. No. You will not have access to the doctors and hospitals you currently prefer. The law says that these public exchanges must depend on essential community providers who serve the low-income population. So they have to deal with the hospitals and doctors in the inner city, hospitals and doctors that charge Medicaid rates, and that's what your doctor, your hospital is going to be paid under these plans.
So what happens a year from now with the employer mandate kicking in?
I'm not sure it's going to ever kick in, because don't forget, the administration quietly delayed it after they tried to get the NBA, the NFL, to woo young people into the exchanges. Their last ploy, their last desperate strategy was to postpone the employer mandate so people who had to have health insurance and weren't going to get it from their employer would sign up on the exchanges. The last thing they're going to do is implement the employer mandate when no one's signing up yet on these exchanges. And
so
you've
what
heard
does that
Nancy
mean
Pelosi
for average
say,
workers?
Well, it means that many of them will lose their on-the-job coverage and have to go to the exchange. Don't forget, the Congressional Budget Office told Congress before they ever passed this law that fewer people would have on-the-job coverage after this law is passed than before it was passed. Only Washington would develop an employer mandate that reduces the likelihood you'll keep your insurance.
Amazing. Amazing, amazing. Betsy, thank you. In the meantime, my next guest provides health coverage, or tries to 13 of her employees. Now Dr. Courtney Dunn has to tell them they can't keep their current plans, much to what Betsy was just saying. Doctor, explain what happened.
Well, we got a letter in the mail just last week that told us that our plan has been canceled and that we didn't make ACA requirements, and that the new plan through Humana that does fit all the ACA requirements is 60% more.
All right, so they at least told you the alternative. There was an alternative, but it would cost you a lot more. So
exactly.
What are you doing now, and what are those workers going to do?
Well, everybody's panicked, and so right now we're working with our insurance broker to try to find some sort of alternative that we can still offer our employees insurance, but we just can't pay 60% more, so we're trying to find an alternative plan. The other choice is to say we can't provide health insurance anymore. Here's a little extra money in your salary, and you'll have to go on the exchange.
What do you do? I mean, that's obviously an enticement for people to work with you, and when that's taken away,
Exactly.
The argument is, well, eventually they'll all go the way of the good doctor, and other practices, small, medium, even large, will be telling their workers the same thing. You're just experiencing it early, and that the workers will be pushed into either these public or private exchanges. Do you think that's the way it's going to go?
I honestly don't know. I was talking with some of my colleagues this morning about it, and they're all looking for plans to be able to cover their employees, but a lot of them do feel that we're all going to have to go on the exchange at some point.
All right. Now, doctor, for your patients who are already wrestling with a lot of this, what do you tell them? I bump into a lot of doctors who say, well, here's your bill, Neil, and you sort it out. Is that the way this is going?
I honestly don't know because I'm an orthodontist, so the insurance works a little bit different when it comes to orthodontics, so I don't have to deal with insurances as deeply as like a medical doctor or even a general dentist.
All right, but bottom line, it's the same type of issue that a lot of front office staffs for a lot of doctors of all types are really taxed just trying to interpret all of this. Do you?
Yeah, I mean, we don't know.
You don't know, right?
Well, yeah, we just don't know. I mean, and when my employees ask what's going to happen in the future, I just tell them I just don't know. We're doing the very, very best we can.
Do you think, doctor, when you tell your patients that, when you tell your staff this, is there immediate reaction? Obviously, they're frantic, but have any of them said, look, doctor, I love working with you. You're a great boss, but I got to get out of here and find coverage somewhere else?
No, luckily our employees are really on our side, and we're just like, wait a minute, you don't even have to provide us coverage. Like, don't worry about it. And I've had some that say, well, I'm just going to pay the penalty. Don't worry about it. But I don't want to leave them high and dry like that, so we're going to try to figure something out.
Well, it's nice to know there are some in the medical community that are actually concerned about this. I've run across more like you than I have on the other side with government. Dr. Courtney Dunn, thank you very much.
Thank you.
Well, stop yapping and start leading. The message from West Point to get these guys back on point.